Are you experiencing deep hip or groin pain, particularly after activity? Maybe you're limping, got some restricted range of motion, and it really hurts when you're doing this range of motion? You may be suffering from femoroacetabular impingement syndrome, or FAI. Keep watching to find out what it is and how to fix it. So the hip is a ball and socket joint. The ball is made up of the head of the femur here, so this thigh bone, and then the socket is made up of the acetabulum, or this part of the pelvis here. What happens in FAI, you have bony overgrowth. So you either have an increase, or a lessened, roundness through here, or you have an overgrowth of the lip, and you get bone on bone contact. And as that happens repetitively, you get a build-up of pain and restriction in range of motion. FAI causes altered movement within that hip joint. So we're going to go over a few exercises now to try and change the way that the hip joint's moving. We're going to be using a thick power band, which you can get from your physio or online, and a resistance band, and just a bit of flat floor as well. The first exercise that we're going to be doing for FAI is using this band. We're going to loop it through something nice and heavy, nice and strong, and we're going to step through with our affected hip in through the band. We're going to bring the band high up on the thigh bone as you possibly can, and we're going to add some resistance. So we're going to step forward, pull forward, and there should be a posterior translation, a backward translation of that thigh bone in the hip joint. And then what we're going to do is aim to stretch the back of the joint capsule through there. So we're going to bring our bottom towards our heels, dropping down. Good. And making sure there's resistance on the band the whole way. So you might have to, this band's quite strong, but yeah, you might have to step out quite a bit and make sure there's resistance, posterior translation on that femur the whole time. And after we've done a few repetitions of that, we can change it up slightly by adding some internal or external rotation in through the thigh bone there. So bringing the foot in or out. And it's just wherever you're feeling a stretch through the back of that joint capsule. This exercise should feel really, really good if you have an FAI. It shouldn't be causing any pain at all. Our second FAI exercise is going to be a stretch. We're going to be stretching our adductor muscles or our groin muscles in through here. So to do this one, we're going to sit in a B sit as far as you're comfortable. Yeah, good. And then we're going to be reaching straight forward as far as comfortable, and you're going to be getting a stretch through all the way up into the groin here. You're going to be holding that for 30 seconds within pain limits. Our last exercise we're going to go over is for glute activation. So what we're going to be doing is called a crab walk. We're going to get Marcus to sit into a slight squat here. And what we're going to do is get him to take a small or larger step over with that furthest leg, yep, and then a small step with this closer leg, yep, and he's going to go over. We're going to be doing 15 steps towards the right, 15 steps towards the left. You can do that 3 times, and it should really feel that burn in through this glute muscle through here.